I'm delighted to be here today and to join my voice to the effort to declare all of our strength and energy against the habit of smoking that has cost us so much, and yet it still plagues us. I represent the 2nd Supervisorial District of the County of Los Angeles, identifiably the most diverse district in the county, and the manifestation of smoking maladies are very, very real. Disproportionately high number of African Americans as well as Asian Pacific Islanders, both of whom are part of the 2nd District experience, show forth higher numbers with respect to this particular problem. And I think we can do something about it, and that's why I applaud the effort that's being launched today. The Department of Public Health has been on the case to declare war on smoking for the benefit of the entire community, and I think we ought to give the Department of Public Works, Department of Public Health, and maybe some of those in Public Works, a big round of applause for their leadership.
And in 1964, when the Surgeon General first reported on the dangers of smoking, over half the men in this country and over a third of the women smoked. That's 1964. Now the good news is that number has dropped to about 20% today. The bad news is it has dropped only to 20% today, and we've been frozen there for a while. So even though you heard from Dr. Fielding that LA is doing a better job down at 14%, we're still kind of stuck where we were. Tobacco companies have been pretty resourceful in getting around what are some of the bans and in recruiting their next generation of lifelong customers. Each and every day in this country, 4,000 kids under 18 try their first cigarette, and 1,000 of those young Americans become lifelong smokers. We have about 46 million smokers in the country today. Tobacco is still the leading cause of heart disease, of lung disease, and cancer. And nationally, we spend about $100 billion a year on preventable tobacco-related illnesses. So, as part of the Recovery Act, one of the first pieces of legislation that the President signed into law, we made an historic investment in some of the most promising community strategies for reducing tobacco use and illness in the country. And $32 million of those dollars are coming right here to LA County on the dual effort to prevent tobacco use and obesity. Now the funds help to build on what's already been a successful effort that we hope will be even more successful and help us then share these strategies across the country. Not only is there an investment in the Recovery Act, but in the recently passed and signed into law Affordable Care Act, there is a renewed investment in prevention, including a requirement that Medicare, Medicaid, and all new health insurance policies must cover preventive care with no cost sharing. So as part of this change, I'm pleased to announce that beginning January 1st, Medicare will begin covering tobacco cessation counseling to help any beneficiary who wants to quit smoking. And that's a big move forward. Now, as you've heard from the supervisor, we know that a lot of people who try to quit smoking find it very difficult, and many are not able to quit on their own. We know we have 5 million of those 46 million smokers who are Medicare beneficiaries today. So if we're successful, we hope that these tobacco cessation efforts are meaningful and will result in fewer smokers.